Hey everyone, and welcome. We're about to dive into something that's, well, absolutely fundamental to everything we do here, OSHA's infection control standards. And look, this isn't about checking boxes or avoiding fines. This is about keeping you safe, keeping your teammates safe, and protecting every single patient who trusts us with their care.
So let's just get right to it. Why is this such a big deal in dentistry specifically? Well, this quote really hits the nail on the head. Our work is, by its very nature, high risk. We are dealing with aerosols, blood, and saliva all day, every day. That unique environment is exactly why understanding and, more importantly, living by these OSHA protocols is non-negotiable.
All right, so to make sure we've got all our bases covered, here's our game plan. We'll start with the why, the invisible threats we're up against. Then we'll look at how infections actually spread with something called the chain of infection. And from there, we'll get into the good stuff, your defenses, how to make our environment a fortress, and finally, how it all comes together in your safety plan.
Okay, first up, the invisible threat. In our line of work, the most dangerous things are the ones we literally can't see. And that means being vigilant isn't just a good idea, it's our most powerful tool.
Think about it. Every single patient, every procedure, even the surfaces in the operatory, they're all potential sources of infection. And we're not just talking about a simple cold here. We're talking about serious bloodborne pathogens, things like hepatitis B and C, and of course, respiratory viruses like the flu and even SARS-CoV-2. Now, this right here, this is a concept you absolutely have to burn into your memory, the asymptomatic carrier. A patient can be sitting in your chair, looking and feeling totally fine, but they could be carrying and spreading a serious pathogen. This is exactly why we have to treat every single patient, every single time, with the same high level of precaution.
So, if we're going to stop infections, we first have to understand how they work. And that's where this idea of the chain of infection comes in. It's a really simple but powerful model that shows us the whole process. And honestly, it's the key to everything we do to keep our practice safe.
So imagine an actual chain with 6 links. For someone to get sick, all 6 of these links have to be connected, unbroken. It starts with the pathogen, the germ. It needs a reservoir, a place to live, like a person. Then it needs a way out, a portal of exit, like a sneeze or a cough. It has to travel somehow. That's the mode of transmission. Then it needs a way in, a portal of entry, like your eyes or mouth. And finally, it needs a susceptible host, the next person to get sick. Our entire job is to break that chain. And this is the really cool part. This is where you have all the power. Every single time you properly wash your hands, or put on a fresh pair of gloves, or sterilize an instrument, you're breaking one of those links. You are literally stopping an infection right in its tracks. So the big question is, how do we break that chain? Well, OSHA gives us a whole toolkit, and it all starts with one core principle. A principle so fundamental, it should guide everything you do with every patient. This is it. This is the golden rule of infection control. Standard precautions. It means you approach every patient interaction as if that person is carrying a serious infectious disease. No exceptions. No, oh, but they look healthy. It is your absolute first and most important line of defense. And standard precautions isn't just one thing, it's a whole system. It's not just about pulling on some gloves. It's about being meticulous with your hand hygiene, always using the right PPE for the task, handling sharps safely, making sure every instrument is perfectly sterile, and keeping your entire environment disinfected. All of it works together. Let's just pause on this for a second. What's the most powerful weapon you have against germs? It's right at the end of your arms. It's your hands. Proper hand hygiene is, without a doubt, the single most effective way to stop the spread of disease. And remember, your gloves protect you, but washing your hands protects everyone. Now let's talk about your armor, your personal protective equipment. I want you to think of your PPE as your personal shield. Gloves, masks, eye protection, gowns. Each piece protects you from a specific threat. But when you use them all correctly, together they create this amazing barrier between you and all those invisible threats we talked about. Okay, so you've got your personal armor on, but that's only half the battle. We also have to make our entire clinical environment a fortress against infection. Let's dig into how we do that. So OSHA gives us 2 really powerful ways to control hazards: engineering controls and work practice controls. Here's an easy way to think about it. An engineering control is a physical object, a piece of safety equipment like a sharps container. A work practice control is about how you do things. It's your technique, like using the one-handed scoop to recap a needle. To be truly safe, you need both. All right, when it comes to our instruments and surfaces, there is zero room for error. I'm serious. Every single reusable instrument has to go through that strict process of cleaning, disinfection, and sterilization. And every clinical surface, it has to be properly cleaned and disinfected between every single patient. No shortcuts. Ever. We've covered a ton of ground, I know, but there's one last piece we need to put into place. We have to take all these individual actions and protocols and build them into one complete, practice-wide safety plan. And that's what we're going to talk about right now. I want you to think of this as your safety playbook. The Exposure Control Plan is your office's official guide for how to prevent exposures and, crucially, exactly what to do if one happens. You need to know where this plan is, and you need to know what's in it. In an emergency, it could be a lifesaver. And please, remember this. OSHA doesn't just hand down rules. It also gives you rights. You have the right to know what the hazards are where you work. You have the right to be a part of making it safer. And you absolutely have the right to refuse to do work that you genuinely believe is unsafe. These rights are there to protect you. You know, at the end of the day, true OSHA compliance isn't about a binder on a shelf. It's about people. It's about building a culture where safety is everyone's number one job, where we all look out for each other. It's about showing up every day committed to protecting ourselves, our team, and our patients.
So, as we wrap this up, I want to leave you with one simple question. What is one thing, just one, that you can do today on your next shift to make our practice just a little bit safer? It doesn't have to be some huge gesture. Maybe it's double-checking a sterilization cycle, or just being extra careful with hand washing. Every little action strengthens that chain of safety. Thanks for your attention, and stay safe out there.